This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
A dilemma is a situation in which one needs to choose.
Paano ako gagaling?
There's an ethical issue.
It's
Supposed to
second.
help first.
Medical Dilemma.
Hi, I'm Sonny Del Rosario and you're tuned in to another episode of Medical Dilemma. The Philippines may still have a low prevalence of HIV and AIDS, but it has been tallying an increase of over 25% annually in the number of new HIV cases. New infections are mainly reported among people with certain risk behaviors, such as unprotected male-to-male sex, transactional sex, and intravenous drug use. Most infections now occur at the younger ages of 20 to 29 years, but more alarming is that very few of those at risk have taken an HIV test, making many HIV and AIDS sufferers largely invisible to society. For our first segment, we have an infectious diseases specialist and a Balik Scientist Awardee. He is also a clinical associate professor at the Philippine General Hospital. Let's welcome Dr. Joseph Adrian Buensalido. Hello, Dr. Buensalido.
Hi, thank you. Thank you for having me here.
Dr. Buensalido, you said you're a Balik Scientist Awardee.
Yes.
Could you just give us a brief background of what this is about?
So I came back in 2014 after my infectious disease training in Michigan in the United States of America. So basically, I trained in all sorts of infectious diseases there. Now I'm back because I came back and promised to do research for the next 3 years. The Philippine Council for Health Research and Development have conferred to me the Balik Scientist Award for 2014.
Okay, thank you so much for that background. Now, let's tackle a few basic questions that will help our viewers, understand more what this HIV and AIDS phenomena are.
Yeah.
Okay. First, what is HIV and what is AIDS?
So HIV stands for Human Immunodeficiency Virus. So it's an infection. It's a virus. It's a living thing that infects people.
Okay.
And this virus, the one that it does is it makes our immune systems very, very weak. And that's why it's called immunodeficiency. It makes our immune systems, our defenses weak.
Okay.
So that's the virus, HIV. AIDS, on the other hand, is acquired immunodeficiency syndrome. So it's the result, actually, of HIV making one's immune system very, very weak, and you are prone to multiple infections, different kinds of infections that usually don't affect healthy humans.
So HIV is the virus,
Yes.
and it causes the condition of AIDS.
Of AIDS, yeah.
Okay, AIDS is a condition. It's not a disease.
AIDS is the advanced HIV condition. So you can have HIV, but you don't have any infections yet. You have not gotten any infections because at that point in time, your immune system may be still normal.
Okay,
But
so
once you progress to AIDS or advanced HIV, that's the time when you start getting all these different infections that don't affect other people.
I see. Now, how did the world come to know of HIV?
So it's actually discovered in the 1980s. There were multiple cases that doctors reported from New York and San Francisco. Basically, homosexual males who seem to be getting certain illnesses that don't affect other healthy beings, human beings. So that's how it started. But these days, after all the research, after the decade that followed, the present view is that this virus, HIV virus, seems to be related to chimpanzees. There are two types of HIV, actually, HIV-1. So chimpanzees are related to HIV-1. And it seems like HIV-2, which is a little bit more, let me say, weaker than HIV-1, seems to be related to sooty mangabes, which are monkeys, also monkeys.
I see. And when was HIV detected in the Philippines?
If I remember, it's 1984.
1984.
Okay. It was earlier in the U.S., of course, and then basically the same type of case that we encountered initially. These homosexual males were coming back to the Philippines very thin, very sick-looking already, and many of them were already AIDS patients or advanced HIV cases.
All right. And have there been any mutations to the HIV?
Well, yes. Throughout the years, there were many mutations that occur, you know? But many of these mutations are in the form of resistance. HIV is a disease that that we treat using long-term medications, lifetime medications.
Lifetime.
Yes, and if you stop taking these medications and don't take it every day, then the virus is able to mutate, change, and get stronger. And so these mutations allow them to survive these the medications that the doctors give the patients.
From what I understand, the most common ways of transmitting the virus is through unprotected sex and needle sharing,
Yes.
especially drug abuse cases. Am I correct with that?
Yes, so basically sexual intercourse in whatever way, penis to vagina, or, penis to anal, oral anal, any intimate contact, sexual contact. And then you're right also, using IV drug use, all right? So sharing of these needles, so that entails blood exposure as well. So that's number two. Number three, in the past, blood transfusions.
Blood transfusion
Was a way to get HIV, but that was before 1985, because you know, during those times HIV was a new disease. We didn't know how to detect it yet as well as we do now. So in the past, blood that was given to patients weren't screened for HIV, but these days we screen all the blood that we transfuse, so that has become less of a problem these days. And the fourth transmission route is from mother to child. So if a mother has HIV while she's pregnant and she delivers the baby can get HIV through that manner.
I see. So ways like sharing utensils
No.
are not through
No.
channels of transmitting the virus.
So intimate sexual contact and the things that we discussed. So just by sharing a utensil, a cup, even in the past, people thought that by using the comfort room
Yes.
that was used by HIV patients would transmit, or they would get infected through that manner. Not true.
It's not true.
Not true.
I see. Now, how is a patient tested for HIV and how reliable is this test?
Yeah, so a blood test is required so that we can screen a person for HIV. So these days, you know, the main way that we screen people is through the blood test that tests antibodies. Because when you encounter HIV from any of the routes that we talked about, your body, our body, will mount a response. We will form antibodies because we want to try to remove that virus. Unfortunately, we can't. But we are able to mount an antibody response to make an antibody, and that is what we test
The
as
presence of the antibody.
of the antibody initially. all right?
Initially.
Although there are other tests, there are more recent tests that came out. It still does the same thing, tests the antibody, your antibody, but also tests for one part of the virus. So that's still a screening test, just the first test. If you are positive for that test, that blood test, we still need to confirm whether it is a true HIV infection. And that is the confirmatory test, still a blood test. That will tell us, yes, the first test is true, and you do have HIV, but still from the blood.
I see. Now, once a patient is confirmed that he or she has the HIV, how does a doctor now manage that condition?
Okay, so it's multi-tiered, no? When you are confirmed with HIV, of course, we educate a patient about all the aspects of HIV, transmission, everything about the virus. what can happen. But then we also need to do, of course, the first tests were screening and confirmatory tests. The next thing to do is to do baseline tests,
Okay.
meaning to check your kidneys, your liver, other infections that you might have at this point. Because when a patient comes, you don't know if the patient has advanced AIDS, or just HIV that's in the early stage. So we check a lot of laboratory tests, X-rays, and then we assess the patient. But the good thing is, once we are able to determine what stage the patient is in terms of his HIV, or is he in AIDS already, we have medications that are very effective that can control the virus,
Okay.
and they're free.
Free.
They're free.
Okay. And these are provided by the government?
They are, well, it started with a global fund, but that project is about to end.
Okay.
So after the global fund ends, the responsibility of continuing that very good project will go to our Philippine government.
Okay. Correct me if I'm wrong. So from what you've described, we can control the virus, we can make it dormant, but we cannot get rid of it.
That's true. At this point in time, there is no cure. But our medications now are very effective, and we can knock out the virus, make the virus undetectable in the patient's blood. Meaning, after maybe a couple of months, sometimes years, of taking these effective HIV meds or medications, when we check the blood of these patients, we cannot find any
You
trace
cannot
of it.
find any trace or
Yeah.
sign of the virus at all.
We call that undetectable. We can make the HIV undetectable in the blood of these patients.
So which means an HIV bearer can actually live a very, very normal life as if he hadn't had the virus.
Yes, that is true. So far, if a patient takes medications, lifespan is generally almost the same as if you don't have the virus
I
in
see.
your blood.
Well, you mentioned lifespan. So how long does an HIV bearer take before he gets the full-blown AIDS?
Okay, so once you get infected with HIV, any of those routes that we talked about, in the first 1 to 2 months, you might get a flu-like condition. So you just think that you got the flu, and it'll go away. During that time, the virus in your blood went up. HIV virus went up. After the flu resolves, your virus goes down. But then it'll go up again,
Okay.
slowly, progressively. During those years, and it takes around 8 years before you develop symptoms.
Around 8
That's
years.
around. This is not the time for all patients,
Yes.
but in general.
In general.
8 years for your virus to accumulate in your blood. During that time, your CD4 count, which is a blood test that measures your immune system, how strong your immune system is, goes down, which just means that your body, your immune system, your defenses become weak over time. And once around 8 years, you're very weak now, you start developing all different kinds of symptoms, different kinds of diseases.
Okay. Well, thank you so much for that very useful information, Doctor. It's now time to take a break. We'll be right back after a few reminders from our sponsors. Thank you so much.
Many of our products were designed to be used in industrial and medical economy.
So if I were you, I would be a lot more careful about what comes out of my mouth, especially in such a place where anything can spread like wildfire.
When you share something to a public, you find that experience, and that experience so rich it could change